Welcome everyone, I'm Spiro, thanks for tuning in. Now real quick, before we get started, if you have not yet made your way over to my BitChute channel, BitChute, BITCHUTE, which is an alternative to YouTube which does not censor, please make your way there now and subscribe. I have a feeling that this YouTube channel may not be around for much longer. I will have the link pinned in the comments of this video, and it'll also be available in the description. Now let's get right into this. About 3 weeks ago, Activist Post published my report titled WHO Official. It's time to remove people from their homes, and COVID task force admits inflated numbers. Now, this report is a follow-up to that one, where I cover how Michael Ryan, who is a high-ranking member of the World Health Organization, stated in a press briefing how the WHO, which is of course in the pocket of Bill Gates, now believes that it's time for authorities to start entering people's homes and removing people from their homes. This was like 3 weeks ago, 4 weeks ago, maybe a month.
That ability not only to isolate cases, but to rapidly detect illness in the context and remove those contacts should they become sick was a central part of that. And as he said, that wasn't, they're using apps now to do that. They're testing apps, but they didn't do it with apps in Singapore. They did that with community workers, with public health workers, visiting the houses, checking on people, checking their health status every day and saying, how are you? Have you got a fever? Have you got a cough? And if a contact has developed a cough or a fever, they were taken immediately for testing. So yes, we need the information technology tools. They help. They are not the solution. Right now, we don't have an alternative to what we would have considered in the old days boot leather epidemiology. Public health practitioners, doctors, nurses, community workers working with communities to detect cases at community level. And the most likely person to become a case is someone who's been a significant contact of another case. And at the moment, in most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Now, I know that many people here, especially in the United States, think that this could never happen. Okay, well, probably those same people who thought that just a couple months ago that it would be impossible for the entire country to be placed on lockdown because people wouldn't put up with it because we have rights, right? Now, this is being said as we're still on lockdown. Now, for those of you who cannot wait for the government to lift the lockdowns, as many states say they're preparing to do, remember, we're being told that things will not go back to normal until there is a vaccine and the entire planet has largely been vaccinated, according to Bill Gates.
You don't get to say, ignore what's going on here. There will be the ability, particularly in rich countries, to open up if things are done well over the next few months. But for the world at large, normalcy only returns when we've largely vaccinated the entire global population. And
now, we have also been told about how we must embrace this new normal. Now, part of that new normal is contact tracing. Well, that sounds normal enough, right? Or at least harmless, kind of like how the Patriot Act sounds harmless, or how Operation Iraqi Freedom may have sounded like a good thing to many people, despite the fact that it was a war of aggression based on lies, which resulted in the deaths of over 1 million people. But hey, it had the word freedom in it, right? If we do not learn from history, we are doomed to repeat it. Just because they put nice language around it doesn't make it a good thing. So what exactly is contact tracing? Well, according to California Governor Newsom, contact tracing, combined with expanded testing, is a pillar of the state's modified stay-at-home order. The goal is to track and trace every person in the state who may have been exposed, then quickly isolate and test them. So in other words, the state cannot open up without contact tracing, and only then it would be a modified stay-at-home order, and not actually removing the lockdown in its entirety, hence the new normal, limited lockdowns. Now, how are they going to accomplish this? Well, in their own words, California is building an army of 20,000 people. This escalated from reports of 10,000 people just about a week ago, who will be trained as disease detectives, serving 6 to 12-month-long gigs, as they call them, that demand skills ranging from data entry to psychology to project management and crisis intervention, saying that the state is providing a, quote, customer service. While others may see this as customer service, some will call it the new secret police. Now, California will serve as the test pilot for this program, which looks to expand nationwide and serve as the template for the entire country. Have a listen for yourself from officials in Ventura County, California.
We are beginning a program today, and it's a pilot program which will certainly grow into something larger and larger, and that is a community contact tracing program. We've done contact tracing all along. That a contact is a person who's been exposed to someone that we document to have the COVID infection. When we find someone who has a COVID infection, those people are immediately isolated. But we also work with them to figure out who their contacts were. Luckily, because you have been doing such a great job of cooperating and staying indoors, and staying isolated, it used to be there were 10 contacts, at least, for every patient that we would find. Now, it looks like there are probably only 2 or 3 or 4 contacts, not surprisingly, because most people have been staying away from others. And that's good news. But the purpose of this program is to bring on people. We're going to start with 10 people. We may bring on up to 50 or even more as the program grows and as we see the needs for it. As we do more testing, we will find more and more people who have COVID-19. And again, we'll isolate every one of them, and we will find every one of their contacts, and we will make sure that they stay quarantined, and we'll check in with them every day. It's not just our county that's bringing more people on. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country. We will be giving intensive training to these people, training not only for identifying and finding contacts, but also in terms of how to be sensitive about doing it. We also realize that as we find more contacts, some of the people we find are going to have trouble being isolated. For instance, if they live in a home where there's only one bathroom and there are 3 or 4 other people living there, and those people don't have COVID infection, we're not going to be able to keep the person in that home. Every person who we're isolating, for instance, needs to have their own bathroom. And so we'll be moving people like this into other kinds of housing that we have available.
Is it just me, or does this sound an awful lot like what the World Health Organization official was just suggesting or dictating about a month ago? Now, the county has since walked back these comments on their Facebook page in response to other comments such as, quote, "They can try. They will have a fight on their hands," end quote. They went on to say that they're not going to be removing people from their homes, that they will provide alternative solutions to people who are unable to isolate in their own homes due to their, living circumstances. But yeah, they're walking this back. Do you see where this is going? Did you not just hear them say with their own mouths that they intend to remove people from their homes, presumably against their will? Welcome to the new normal. Welcome to COVID-19 84. Will you just comply when they show up at your home to remove your wife or your children? After all, they're going to tell you it's for the greater good. I think you may have a pretty good idea of my position on this. Now, right now, there are many job listings for contact tracers online. Private security firms are, quote, urgently hiring, and they want military experience and offer full benefits. This may sound very appealing to millions of people who are out of work, struggling to put food on their families' tables. Okay? Join the new brown shirts. Hey, join the state. Join the COVID 1984 Army because it pays well. $25 an hour. Can you imagine how the founders of this country would respond to this level of tyranny? This is why we have historical quotes such as, "Give me liberty or give me death." And the tree of liberty must be refreshed from time to time with blood of patriots and tyrants. Now, just to be crystal clear, I'm not advocating violence, but one thing you need to know is, where is your line in the sand? Forced vaccinations? Or how about when they start disappearing dissidents under this contact tracing program that's funded by people and organizations like the Clinton Foundation? No surprise there. It's not my job to tell you what to think or tell you what to do. It's up to you to make those decisions. All I'm doing is trying to help provide the information, put the pieces of the puzzle together. That way you have an alternative perspective of what is taking place. Because right now, the way I see it, this is an orchestrated, pre-planned operation that is targeting you and me. Right now, it's pointed right at us. And tyranny is knocking on our door. The only question is how and when you will respond.